President Biden unveiled a new fund to help restaurants hard hit by the pandemic Wednesday.
Many had to furlough or lay off workers or close entirely. Now, as we vaccinate Americans, customers are coming back. Our vaccination progress and our economic recovery is going hand in hand. As that happens, we want to make sure that our restaurants, bars, and other dining establishments can staff back up, and they can come back as well. Right now, only about a quarter of the restaurant owners expect to return to normal operations in the next 6 months. We can do much better than that.
The Restaurant Revitalization Fund offers grants covering a range of expenses like payroll, rent, utilities, and supplies. The president said the program received 186,000 applications within the first 48 hours. For more on the nation's pandemic response, let's bring in CBS News reporter Alex Tin. Hi there, Alex. So the federal government on Wednesday said it will support waiving intellectual property protections for COVID-19 vaccines. How soon could other countries produce vaccines based on that information?
Well, that is a good question and has been the subject of a lot of the debate around this very waiver. You know, the way that this initial proposal was set up was the idea was that you have this excess manufacturing capacity, these plants in other countries that aren't making either critical drugs or aren't making COVID-19 vaccines that could theoretically be repurposed to make COVID-19 vaccines, but haven't been able to, make their way through the technology transfers or the necessary licensing requirements in order to formally make those COVID-19 vaccines coveted from Pfizer or Moderna or Johnson & Johnson. And the idea of the waiver is that by removing these intellectual property protections, theoretically, these plants could ramp up and start making their own doses of those Pfizer, Moderna, and Johnson & Johnson vaccines. But obviously, ramping up these vaccine supply, as we've seen right here in the United States with Emergent Biosolutions and Johnson & Johnson, is no easy task. Experts say it could take months, if not years, to ramp up these plants. And obviously, there's a whole slew of other factors that still need to be hashed out at the World Trade Organization between the United States and other countries as to just how these intellectual property protections will be lifted, how the waiver will work, how they might compel or incentivize companies like Pfizer, like Moderna, like Johnson & Johnson to transfer the knowledge they have on how to make those vaccines to these other factories. So again, it theoretically is going to be a big step. It theoretically could really help the world make a lot of these needed COVID-19 vaccines, but it's probably not anytime soon.
Well, Alex, despite falling coronavirus cases, the CDC is now warning of yet another potential surge here. What are they predicting?
Well, there was a report in the CDC's MMWR today that really outlined an interesting model, 4 different scenarios that the Centers for Disease Control and Prevention, working with top academic researchers from around the country, looked at in terms of where this pandemic in the United States will go over the next few months. Now, in all 4 of the scenarios they looked at, which were a mix of high or low compliance with those, important prevention measures we've all heard about, wearing a mask, social distancing, what have you, combined with whether or not a lot or a little portion of the U.S. is able to get fully vaccinated, they were able to find a sharp decline. That was their words by July 2021 in almost all 4 of those scenarios. But when you look at the details of those 4 scenarios, and this is what the CDC modelers pointed out, is that even before you get there, reduced compliance with masking and social distancing, and again, all those prevention measures we talk about, could potentially lead to new COVID-19 surges between now and July. And of course, if we don't have a lot of fully vaccinated people by July, that sharp decline they talked about may not be enough for a lot of places to avoid the COVID-19 hospitalizations and deaths everyone's concerned about.
All right. Well, Johnson & Johnson's vaccine is back in rotation after it was temporarily paused due to concerns over rare blood clots. How are potential consumers and states reacting to its reentry?
Well, it was interesting when we first saw the pause of Johnson & Johnson's vaccine around the country. One of the first things we noted was just how many of these single-shot vaccine doses had been reported delivered by the CDC, but yet to be administered by states and local jurisdictions. That gap, which amounted to basically 50% of the delivered supply that hadn't been administered, has essentially remained since the pause was resumed. Now, the reasons for that are mixed. Obviously, there is some hesitation there. There has been a slowing of demand for all the vaccines, Pfizer, Moderna, and Johnson & Johnson. And of course, the incoming supply that's been coming in from the Biden administration has also decreased. This week, the Biden administration told states that they would be giving them the lowest amount of Johnson & Johnson vaccine since March. But all of these factors together, really show two things. Number one, there is a slowing of demand, not just for Johnson & Johnson's vaccine, but for all the vaccines. And number two, states and local health providers are going to start becoming a lot more strategic about how they use these vaccine doses as they try to target harder to reach populations.
Meanwhile, Pfizer's shot is expected to be the first coronavirus vaccine approved for use in adolescents. When might that happen, Alex? And what's the youngest age we might see vaccine recommendations for?
Sure. So what the Food and Drug Administration is considering right now is data that was submitted by Pfizer for using their COVID-19 vaccine in adolescents as young as 12 years old. And you might recall from a few weeks ago, this data showed very, very strong efficacy among these adolescents as young as 12 years old. Virtually 100% efficacy at preventing COVID-19, and obviously no major safety or other issues. That data is being considered by the Food and Drug Administration now. A federal health official tells CBS News that they expect the Food and Drug Administration will probably issue their decision amending Pfizer's emergency use authorization probably by the end of this week or early next week. What we expect to happen after that is the Centers for Disease Control and Prevention has their panel of independent advisors that make recommendations about how to use the vaccines. They will convene and consider updated recommendations for using the Pfizer vaccine in adolescents. We expect that meeting to happen on Wednesday. So assuming that all goes to plan, that FDA issues their emergency use authorization amendment and CDC issues their updated guidance on Wednesday next week, we probably could be seeing adolescents getting their vaccine shots by not this weekend, but next weekend.
Wow, it's pretty remarkable to think about that. So many parents are anxious about what is going to happen with respect to the time frame on those vaccines for their kids. Alex Tin for us. Alex, thank you very much.
Thank you.